Hey guys, welcome to Man Medicine, where we talk about how men can optimize their health and escape the collapsing U.S. healthcare system. I'm going to talk to you guys today about a subject that comes up a lot in the world of TRT. Comes up a lot when I consent a man for testosterone, and there's a lot of discussion about this on a lot of the TRT and bro forums, and that is androgenic alopecia, male pattern hair loss, and especially as it relates to the use of finasteride, which has become a bit controversial now that we're hearing more stories about something called Post-finasteride Syndrome. So I kind of want to unpack that a little bit for you guys today and show you some of the actual evidence that's out there, maybe educate you a little bit on it so you can make some decisions in terms of what you want to do. But this is something that comes up very commonly, and it's one of the reasons that in some cases, especially in younger men, they shy away from considering testosterone replacement therapy because they're worried about losing their hair. So we're going to talk about that a little bit. Okay, so male pattern baldness. The typical male pattern baldness is properly referred to as androgenic alopecia. Extremely common, 80% of men by the age of 80, 50% by the age of 50. It's also very common in women, which is particularly distressing. But this is a big deal, especially for young guys in their 20s that are starting to lose their hair, which is not uncommon. I know I had friends in college that were starting to thin. And obviously in your 20s and 30s, those are your dating years in many cases, and so this can be like really emotionally devastating for young men and cause them a lot of like psychological stress. So it's a multi-billion-dollar market. So when something comes along that's in your life that's that distressing to you, you can imagine that there's going to be all kinds of charlatans out there that are going to pop up and offer you their miracle hair loss cure and treatment for lots of money. So this is big business. So having said that, if you're waiting for this, if you think with this video I'm going to give you the magic cure for hair loss, prepare to be disappointed. If I had that for you guys, I would give it to you, and I would be probably so wealthy I could just retire and disappear off to my tropical island and never be heard from again. But I do not have a cure for male pattern baldness, obviously. So let's talk about this a little bit more. And again, we're going to mainly focus on finasteride, but I'll give you guys some of the other treatment options that are out there, and that way you have the information. You can make a decision about what you want to do. Okay, so this is a paper here, International Journal of Molecular Biology, the role of mutations on gene AR, androgen receptor, in androgenic alopecia. So this is where male pattern hair loss, the genetics of male pattern hair loss or androgenic alopecia, they're actually incredibly complicated. There's at least 200 genes that they've identified so far. The bulk of them, at least the more common ones, are located on the X chromosome. So you can't blame your dad for your baldness, okay? This came from your mom and maybe from her grandfather or her father. Anyway, the X chromosome is passed in men. It comes from the maternal side of things. Okay, how do you make the diagnosis? Usually it's pretty obvious, but I would submit to you guys that if you're starting to experience hair loss, regardless of your age, but especially if you're in your early 20s, I think it's a good idea to have a physician take a look at you and maybe even request a dermatology referral, because there are a lot of causes of alopecia that are not androgenic and could be non-hormone related, could be non-genetic, and perfectly treatable and reversible if the treatment is initiated early. So that may even involve like a scalp biopsy. So I wouldn't just assume necessarily that it's androgenic alopecia, even though, obviously odds are that's probably what it is. I think it's a good idea for you to get in to see an expert on this, and just make sure you don't have something else that's easily reversible. So let's talk about testosterone, because again, this is something that men are afraid of, and one of the reasons I've heard on a number of occasions why they're trying to either delay testosterone therapy or forego it entirely. So the big question is, am I going to lose my hair if I start on testosterone replacement therapy? And the answer is, if you have the genes for male pattern baldness, usually one of the ones on the X chromosome, but it could be others, the answer is probably yes. Okay, now you're not going to, TRT will not necessarily accelerate that, okay? If you have low testosterone, you very likely have low DHT levels, dihydrotestosterone, which we're going to talk a lot about here, which is the primary culprit in androgenic alopecia. Now, when you restore your testosterone levels back up into the healthy normal range, you will also have a normal healthy amount of DHT. So you're going to lose hair proportional to your DHT level, okay? So you will lose hair at the rate that you would have if you had never developed low testosterone in the first place. Does that make sense? Now, of course, if you go into the supraphysiologic range, the higher your DHT level, it would make sense that the speed at which you lose your hair would increase. And of course, if you're using any sort of DHT-derived anabolic steroids, which many bodybuilders do, then not surprisingly, you're going to accelerate hair loss. But if you don't have one of these genes, I've known bodybuilders that take ungodly amounts of anabolic steroids, including all of the nasty DHT-derived drugs, and they have a full, thick head of hair, like into their 40s and 50s and beyond. If you don't have the gene, it's not going to happen. So just keep that in mind. Much of this is genetic, and TRT will accelerate it, but only to the extent that it would be accelerated if you had a normal testosterone level. So that's maybe one reason not to go too super physiologic in your dose, because the DHT level will track up with that, and maybe you'll accelerate things faster than they would otherwise that they would otherwise go. Okay, finasteride. What is it? It is a 5-alpha reductase inhibitor. So 5-alpha reductase, that is the enzyme. As you can see here, it converts testosterone, uses NADPH as a catalyst. It converts testosterone into dihydrotestosterone, which ultimately is the culprit that is involved in hair loss. Okay, so there are 3 different isozymes of the 5-alpha reductase inhibitor. Of the 5-alpha reductase enzyme, type 1, 2, and 3. And it's not super important that you know these in detail. So finasteride, it inhibits type 2 and type 3. So type 2, that is found mainly in the outer root sheaths of the hair follicles. It's found in the epididymis, near the testicles, vas deferens, and in the prostate, which is why finasteride at the 5 milligram dose, it's typically used 1 milligram a day for hair loss, but at the 5 milligram dose is used quite commonly in older men to treat BPH, benign prostatic hypertrophy, and it's moderately effective for that. Type 3 is basically everywhere. I mean, skin, prostate, pancreas, uterus, intestine, testes, kidneys, brain, liver, it's kind of everywhere. And then type 1, that's mainly like in your sebaceous glands, your sweat glands, that sort of thing. So finasteride inhibits type 2 and type 3. There is another DHT blocker called dutasteride, which is very potent, much more potent than finasteride, and it affects all 3 of those. It's not really that important for the purposes of this talk, but you may hear this discussed like in some of the forums. There are different isozymes of this 5-alpha reductase. So this is the bare bones basics of how this whole process works. So the androgen receptor, it binds DHT inside the cell, okay, and then this other very complex molecule called beta-catenin comes, and so all 3 of those, so DHT bound to their androgen receptor, beta-catenin also binds, and then that all goes into the nucleus, and it affects the expression of a number of different target genes, and it basically leads to hair loss. So it suppresses genes that are needed to maintain the health and the vitality of your hair. So you can imagine that if you lower the amount of DHT that's making its way into the nucleus, then maybe these target genes are not going to be repressed quite as much, and you'll have a thicker, more luscious head of hair. And that's basically how it works. Okay, so how effective is finasteride at the 1 milligram dose? So this is an article that talks about this. It's from the Society for Investigative Dermatology, use of finasteride in the treatment of men with androgenic alopecia. This is dated 2003. So it quotes a number of older studies, but the bottom line is it's pretty effective. So they were able to, through scalp biopsies, find that at the 1 milligram dose, you could drop the level of DHT in the scalp by about 64%. So you're still going to have some activity in that area, which is why, I'll show you here with this next slide, there's not always a complete response and complete regrowth in a lot of men. And some men actually do get worse, even though they got finasteride there, because there is still some DHT floating around, but it does reduce it significantly, even at the 1 milligram dose. So this is a chart from that study, looking at 12 months and then 60 months, where they followed a large group of men. And so the black column here, this is finasteride once a day. The gray column is placebo. So you can see, the no change group, which generally, if you're losing your hair and you can arrest it, no change at 12 months or even at 60 months. I mean, that's a win right there. You will not lose more hair, at least in 40% of these men. And then there was a significant amount at the 12-month mark that actually improved, and they actually regrew some hair. And a tiny percentage actually got worse at 12 months. If you follow this out to 60 months, I mean, you see that the same basic trend continues. Clearly, the placebo is going to get worse because they're not taking anything. But a significant number of these men, well over 50%, probably close to, I'm not going to add this up, but it's close to about 80%, either didn't lose any more hair than when they started by 60 months, or actually regrew some hair. So that's not too bad. And then you can see there's a small but not insignificant group, it's a little bit less than 10%, that despite having finasteride on board, they still lost some hair. So it's not, nothing is 100%. So what are the side effects of finasteride? So there's some, we'll talk about post-finasteride syndrome, because that can really be a big deal. But one of the ones that doesn't get talked about is some of the effects in terms of mood and depression, anxiety, that sort of thing. And I'll show you why they think that this happens. So this is an article from JAMA Internal Medicine 2017, the May edition, Association of Suicidality and Depression with 5-alpha reductase inhibitors. And thankfully it's not common, but there is a signal there. And they were saying basically with some of the crude data that they looked at, if you were using finasteride, there was a 3.33% chance of experiencing depression or suicidality. They combined those two versus like 2.5% if you weren't. So there's a signal there. It's something to be aware of, and something to be cautious about. I think if you suffer from depression, anxiety, or really any sort of psychological or psychiatric issue like this, there is a chance, even though it's small, that finasteride could potentially make that a little bit worse. So just kind of, if you're going to go that route, just kind of go into it knowing that, and maybe just kind of check in with yourself, maybe a little bit more often than you normally do. Okay, so why would a DHT blocker lead to depression or anxiety, or let alone post-finasteride syndrome, as we're talking about? So there are people out there, apparently on Reddit, from what I've heard, who say that once you reach sexual maturity, like DHT is kind of a pointless hormone. It doesn't do anything, and it doesn't matter if you block it. You're not going to have any issues. And that's not really true, because the metabolism of testosterone doesn't just stop. First of all, it goes to DHT and estradiol, but it doesn't stop there. Those two compounds are further metabolized into other steroids that have biological effects. So if you block DHT, you're going to block all of the downstream metabolites of DHT, again, which have biological activity. And there's 3 of them in particular that I'm going to talk about here, but there are actually many, many more. So the big 3 are these. The thing is, they're neurosteroids, right? So these are steroids that cross the blood-brain barrier, get into your brain, and start having effects in the CNS. So kind of important stuff. So the 3 main ones I just want to mention briefly are allopregnanolone, androstenediol, and then tetrahydrodeoxycorticosterone. Say that 10 times real fast. So THDOC is what it's abbreviated as. So allopregnanolone, all of these they think are related to the GABA system, which is a bit too complicated for me to get into right now. But allopregnanolone definitely involved with mood, anxiety. It is thought to be one of the culprits in premenstrual syndrome in women. Okay, but clearly it can affect men as well. Allopregnanolone levels are related to certain types of epilepsy. Okay, because GABA, it tends to suppress neuronal activity. It tends to be sedating. Tends to be calming, and so when there's an absence of GABA inhibition, sometimes you can experience seizures. Okay, androstenediol, very similar. It works again with the GABA receptor. It's also involved in reward and pleasure. It's involved in anxiolysis, so calming anxiety. So if you're feeling anxious, this particular neurosteroid can help calm you a little bit. It has pro-sexual effects. It also has some anticonvulsant effects. So again, related to seizures and epilepsy, that sort of thing. And it's interesting because a lot of men that start on testosterone therapy who are kind of anxious little nervous Nellies. What I have seen clinically is, and many other physicians have backed me up on this, is that testosterone, rather than having the, more aggressive sort of roid rage type of stereotype symptoms that you hear about in the media, it tends to have a calming effect. And really, it looks like that calming effect probably is because it is converted to DHT, which is then converted into all of these different neurosteroids which affect the GABA system, which have a calming anxiolytic effect. Okay, so that's kind of interesting. All right, and then the last one here, THDOC, THDOC, whatever you want to call it. Again, also, it's called an allosteric modulator of the GABA receptor. It has sedative, anxiolytic, and anti-seizure properties as well. So all three of them work with the GABA receptor in different ways, and they have generally a calming effect. But they're definitely related to mood. So you can imagine that you don't want to screw with these, potentially. Okay, the messing around with the levels of these neurosteroids in your brain in someone who's perhaps predisposed genetically could be a problem. Because clearly, I put many older men on high doses of finasteride for their prostate at the 5 milligram dose way back in the day when I was doing primary care. We didn't know anything about neurosteroids. And you know what? I didn't have a whole bunch of them coming back to me, complaining of psychiatric symptoms. I just didn't see it. But as time goes on and the use of these drugs are becoming more common, and of course now that we're delving deeper into the genetics of medicine, and getting a better understanding of the fact that we're all a little bit genetically different. If you have a genetic susceptibility, perhaps you have a polymorphism, for example, that I'm just speculating here, that causes you to have low levels of these particular neurosteroids to begin with. You might be very sensitive to further drops in those if you were to take finasteride. So it's just a hypothesis, but that could explain why some men have these neuropsychiatric symptoms and other ones do not. The sexual side effects, this one gets a lot of press for good reason. Thankfully they're not super common, but in this article here, Dermatology Online Journal, this is dated 2017, sexual side effects of 5-alpha reductase inhibitors, finasteride and dutasteride, as we talked about before, comprehensive review. They go into deep details about this, but the bottom line is somewhere around 2 to 4% of men will have some sort of sexual side effects like decreased ejaculatory volume, erectile dysfunction, lower libido. There's some case reports of decrease in penis size, like stuff like that. So not common, roughly 2 to 4%. And with the exception of guys that fall into this post-finasteride syndrome, generally when you discontinue the medicine, these kind of things will go away. But again, there's a small percentage of men, we don't know exactly what that is, that have long-term, like many months, and in some cases permanent sexual side effects with finasteride. So we'll talk about that here in just a little bit. There's also some mention, this isn't a sexual side effect, but I thought I'd bring it up, and I think it's mainly with older men, but you can get something called orthostatic hypotension, which is low blood pressure, like when you stand up or you have a change in posture suddenly. So for example, like you're laying on the couch, maybe you haven't drank a lot of water that day, but you otherwise feel okay. If you get up too quickly, What's supposed to happen is your vessels are supposed to contract and we're supposed to push blood back up into the heart so it can get to your brain. Maybe that doesn't happen as well. And, the blood kind of pools in your extremities, your cardiac output drops, and you get woozy, dizzy, and sometimes you pass out. It's actually happened to me before once when I got super dehydrated in the military. I stood up, the room started spinning, and down I went. And it was just because I was dehydrated. But that's orthostatic hypotension. So there's a certain rate of that with finasteride above and beyond placebo. But again, I think it's mostly in older men. And again, if a lot of these guys are also on alpha blockers for their prostate, which is, alpha blockers are notorious for causing orthostatic hypotension. Many of them are on diuretics. So, again, if you're a doc out there and you prescribe this stuff and you're prescribing it to, a 75-year-old man who's on, multiple different antihypertensives, and maybe he's on, an alpha blocker for his other prostate symptoms, you might want to talk to them about that. Just kind of warn them. Make sure they stay hydrated. Make sure they get up nice and slow. No sudden movements. That sort of thing. So, okay. What about fertility? This a lot of men are concerned about this. That not only am I going to get these sexual side effects, but now I'm going to be infertile. I'm not going to have kids. I'm going to drop my sperm counts. And there's a lot of research on this in the andrology world. This is the Journal of Andrology, volume 31. This is from March, April of 2010. Effective 1 milligram dose of finasteride on spermatogenesis and pregnancy. And this is kind of a back and forth discussion of some andrologists discussing this. But bottom line, the majority of the studies show that at the 1 milligram dose, everything seems to be okay. There's not really any changes in semen parameters, no change in, in terms of like morphology and sperm counts, that sort of thing, and no decrease that they could detect in pregnancy rates. Now, that hasn't been hashed out at the 5 milligram dose, and they think that there actually might be some issues at the 5 milligram dose. So you just got to be aware of that. Definitely at the 5 milligram dose, they quote a roughly 25% decrease in ejaculatory volume, which makes sense because it shrinks the prostate. But of course, a lot of guys that are on the 5 milligram dose are elderly guys who really don't care if they're fertile or not. But for whatever reason, if you have a younger man or even an older man that maybe still wants to have kids, and you want to use that 5 milligram dose, that's something you have to counsel them on. And, just be aware that at the higher dose, there could be some fertility implications. But the good news is at the 1 milligram dose, all the data out there that I could find seems to support that, that it's going to be okay. Okay, let's talk about the big one here, Postfinasteride Syndrome. This syndrome, it wasn't on anybody's radar when I was in medical school or residency or in my early primary care days. At least not, it hadn't made it over to the primary care world. I think maybe the urologists were starting to notice cases of this, maybe 15, 20 years ago, but it's actually gotten a lot more press lately, which is good. So this is the article that I'm going to get most of this information from here. Post-finasteride Syndrome, an emerging clinical problem. It's from the journal Neurobiology of Stress from volume 12, 2020. So you can look this up on Google. So there's a few diagnostic criteria in order to officially, qualify, I guess, for this diagnosis. But there's a lot of symptoms that fall outside of this that are very common. So just briefly, of course, you have to have post-finasteride syndrome, you had to have taken finasteride, or really any 5-alpha reductase inhibitor, and then enduring sexual dysfunction after treatment, okay? And by enduring, they usually mean more than 3 months, although many men with this condition suffer for months and months and months, and as I mentioned, often years. And there's some concern that in some of these guys, this potentially could be permanent, and it's quite difficult to treat in some cases. We're not really going to get into that in this talk, but this is bad stuff. If you get this is really, really unfortunate. Okay, additional criteria: enduring reduction or loss of sexual desire. So libido just goes into the toilet. Erectile dysfunction is a major player here. Like decreased sensation from sex, just decreased in sensation in general in the genital area. Things kind of feel dead down there is how it's been described. But there's a whole list of other symptoms. I have this chart here that I'll show you, reported symptoms of post-finasteride. So, Yeah, orgasmic anhedonia. Like you orgasm, but it just doesn't feel good. It doesn't feel bad. It just, you don't feel anything really. But the psychological ones, depression, anxiety, suicidal ideation, impaired mood swings, these are the things that I mean, it's all rolled in together, but these are the things that can be very, very devastating. And there are case reports of men committing suicide, over this. So it's a very, very big deal. There may be some physical things, in terms of gynecomastia, muscle weakness, chronic fatigue. It says penile shrinkage and loss of sensation. Well, as part and parcel with this. So this is a devastating condition. As far as how frequent this is actually off the Post-finasteride Syndrome Foundation website, which I'll show you here in just a second. They were saying 1.2% of young men who took finasteride for 206 days or longer, so a significant amount of time, developed persistent erectile dysfunction that lasted an average of 4.2 years after quitting the drug, according to the Post-finasteride Syndrome Foundation. So 1.2% had long-term ED. That's either really, really high or really, really low, depending on how you look at it. To me, that seems pretty high and kind of scary. And again, nobody really knows what causes this. My personal theory is that it has a lot to do with alterations in these neuroactive steroids, which are like the derivatives of DHT. That has as yet undefined downstream effects. So there are people saying that it causes permanent epigenetic changes, that it damages the pudendal nerve, which is responsible for sensation down into the perineum and the genital area. There are some studies showing that there are some abnormal, nonspecific signals on MRI scans, specifically in areas related to sexual arousal, related to depression and anxiety. So there's little bits of data coming from multiple different fields that I'm hoping in the next few years can kind of come together and maybe come up with a plausible mechanism. Because once you have that, then you have a better chance of coming up with a coherent treatment strategy, which we don't really have right now, other than really high dose testosterone, which in some cases can work. I don't want to scare you away from using finasteride, because again, it is effective. And the vast majority of men do just fine on it. I've prescribed it for years. And I personally haven't had any issues with men with any of the potential side effects I just talked about. That's just me. But the literature is full of case reports. And we know that, I showed you the numbers, it's not insignificant. And if you're that person, then, that's serious, right? So this is just a final little slide here showing the different ways that, and we didn't talk about all of these, but the different potential side effects in different organ systems of 5-alpha reductase inhibitors. So we talked about the reproductive system. We talked about the brain. I didn't get into the colon. There's some rat studies that are really interesting that showing that finasteride, especially at high doses, and especially when you withdraw the finasteride, you can get some permanent changes, or potentially permanent changes in the gut microbiome, some issues with leaky gut. We don't know if that's part of this post-finasteride syndrome. It certainly could be. The kidney issues, I'm not going to touch on those. Those were mainly in animals, and again, with very, very high doses. And then we mentioned the behavior, depressive-like symptoms, and anhedonia. Again, that I think ties into these neurosteroids a little bit. So, the thing I want you guys to take home is, in endocrinology, there's when you block hormone, there's no free lunch, okay? And that's why, in general, I'm generally opposed to the blocking of hormones, okay? Because, again, there is no free lunch. There's always a cost when you block something. So that's why, and I'm not going to go into this, but that's why I'm almost universally opposed to aromatase inhibitors. And I'm generally opposed to 5-alpha reductase inhibitors in most cases. It's just important to remember, these hormonal systems are extremely delicate. They're very precise. They've evolved over millions of years. And you can't expect to shut down one branch and not have downstream effects in other areas, and in other areas that maybe you wouldn't expect that you'd have problems with. So again, there's no free lunch in endocrinology when you block hormones. So I'm not saying don't do it. But you really you need to know what you're doing, and you should hopefully you're doing it under the supervision of a physician who knows what they're doing. Okay, so this is just a screenshot here from the if you want to learn a lot more about post-finasteride syndrome and talk about some of the the political parts of it, the advocacy, some of the ongoing research. This is a pretty good website, Post-finasteride Syndrome Foundation. If you just Google this, you'll find it. They have a lot of useful links and information that you can look at if you want to go into that. Okay, so so what are your alternatives? Let's say you're a young man, you've got the gene. What can you do to hold on to your hair? Maybe you don't want to use finasteride, at least oral finasteride. Well, I mean, there is some data showing that topical finasteride, especially when you combine it with some other agents like minoxidil, ketoconazole, that sort of stuff, can actually be effective. And you can, that's kind of an ideal scenario because you want to reduce DHT levels at the scalp, but you really don't want to mess with your DHT levels systemically. And so a topical application can be somewhat effective for that. And this is an article here from the Journal of Drugs and Dermatology, dated 2018, a systemic review of topical finasteride in the treatment of androgenic alopecia in men and women. You can look that up if you're interested, but it showed to be effective. Okay, now I'm not aware of any. I could be wrong, but I'm not aware of any like big pharma products out there that include topical finasteride. So you may need to go to a compounding pharmacy, and again, typically they will be combining, and I think this is a good thing, they'll combine topical finasteride with 1, 2, or 3, or even 4 other agents, mainly one of which is almost always minoxidil, that also may or may not have some efficacy as well. So talk to your doc. If you want to do this, they're going to have to probably get you your medication from a compounding pharmacy. Okay, and there's nothing wrong with that. Compounding pharmacies are great. I don't care what the endocrinologists say. So briefly, I'm not going to go too deep on minoxidil, which is Rogaine. It kind of works. It will slow down hair loss. You will regrow some hair. It's not the same kind of hair that you lost. It's this sort of thin, wispy stuff. It works best on the crown. It's not great on the hairline. And as soon as you stop it, that hair is going to fall out. So just, don't expect miracles with that. So, honestly, if you want a permanent solution or a permanent treatment, surgery is probably your best bet. I'm not a hair loss expert, but, going for something that is surgical is probably going to be your best long-term solution. Okay, so if you get on YouTube, you can look up follicular unit extraction, or FUE. It's extremely common. There's like thousands of videos on this stuff, and basically this is removal of thousands, in most cases, of tiny little individual hair follicles from areas in the scalp. We didn't touch about this very much, but there are DHT resistant hairs. This is why like most bald men still have hair like in the back and on the sides. It's just this stuff on the top that falls out. That's the stuff that's DHT sensitive. Well, they're transplanting hair, and as you can see from this guy, like they kind of rebuilt a hairline for him. It doesn't look half bad. Very expensive. It takes probably, from my research on it, it's like 18 months to like maybe 12 to 18, maybe longer months, depending on how many follicles you transfer, to completely like regrow your hair and have it as good as it's going to get. And then it's not uncommon to have to go back and have like touch-ups and things like that. So that's probably your best bet. You're going to see a lot of clinics, they're using PRP, scalp injections, and then exosomes, which I'm not going to get into here. Exosomes, I've seen some pretty impressive before and after pictures. They're very expensive. There's not a ton of literature yet on this, although I think there will be soon. But again, what you have to remember about all this stuff, whether it's finasteride, whether it's PRP, exosomes, this does not solve the underlying problem. You can't, which is your genes. So until we find a way to edit your DNA, you will have androgenic alopecia, and you may regrow hair with PRP or exosomes, but that hair ain't sticking around forever. Okay, you're going to have to go back And again, we don't really know, how long it's going to last and how many times you'll have to go back. But there's a good chance you're going to have to go back, and perhaps it's not going to work as well when you go back. And there's going to be diminishing returns, but not necessarily diminishing costs. So again, these things are, other than the surgical option, these are all like delaying tactics. They're designed to help you hold on to what you have and maybe regrow a little bit. Okay, that's the depressing truth about this. Now, some guys go the non-surgical hair restoration route, which is basically like a modern hairpiece, which most guys at first are like, oh my God, no, that's ridiculous. They have images of like in a strong wind or something, or a storm, the guy's like toupee falls off. But listen, I'll be honest with you. I have a good friend of mine who went this route, and you can't tell. It looks really good. It looks really, really good. So something to think about. It does require monthly maintenance, so there is some cost to it, but I gotta admit, at least in him, he pulls it off. It looks really good. I could never do this because it is glued to your scalp. They shave your head and they glue it to your scalp, and I could just see this like getting ripped off my head or like torn off in a jiu-jitsu match. So not that I want to do it. I'm fine being bald. I think I can pull it off, but yeah, I don't think I don't think I could do the non-surgical hair restoration. And then the other thing that you'll see, which doesn't look half decent here based off this picture, is scalp micropigmentation, which is a form of cosmetic tattooing that recreates a hairline in guys who are very bald and who like to have that like shaved head look. This is from Scalp Micro USA, which is a YouTube channel that has a number of like client stories and stuff like that. So you can go check them out. But like, look at this dude. Looks, I've never seen one of these in person, but I don't know, looks pretty good to me. So that is a permanent, or at least semi-permanent solution. I think you have to go in and get these touched up every few years. You probably have to like put sunscreen on it and stuff like that, just like a normal tattoo. So that may be an option for you. There are no supplements, guys, out there that have been proven effective. So just don't fall for the scams. There's no freaking herbs that are going to regrow your hair, despite what you might hear on the internet. Okay, what's the bottom line? So yeah, finasteride, it does work. I think it's reasonable to expect, if you were to start on finasteride, that you will probably mostly you'll halt your hair loss. Let's put it that way. And then there's a significant percentage of you that may start to regrow some hair, 12, 24, 36 months into that process. There are studies going out 10 years, which seem to indicate that effect is persistent. Okay, most men get away with this without any side effects. They do just fine. There's no potential downsides in terms of fertility, but there is a small but not insignificant chance of some pretty damn serious side effects, sexual side effects, neurocognitive, neuropsychiatric side effects. And if you're one of these really unfortunate, 1% guys that gets post-finasteride syndrome, this is something that can be absolutely catastrophic for the rest of your life. So you just have to think about that before you get on finasteride for any length of time. So, again, I'm not I have prescribed it. I do prescribe it for men, but we have this conversation before I do it so that they understand what they're getting into. The final thing, I guess, that you just really need to internalize is, barring some major unforeseen medical breakthrough in DNA technology or some other, stem cell technology or something along scalp transplants, I don't know, something like that. If you have these genes, if you have the genes for androgenic alopecia, at some point in your life, you are going to be bald. You're going to have significant baldness. Let's put it that way, whatever that may look like. Now, with some of these treatments, you may be able to delay that well into your 50s or 60s and maybe even 70s. And at that point, maybe you don't care. But, your genes are your genes. And so, all of these therapies that are out there, I think at the most are going to sort of delay things for you. And that might be good enough, and that's okay. Especially when you're in your 20s and 30s. You may consider finasteride through your 20s, and then maybe in your 30s you just kind of let things go and see what happens. It's entirely up to you, but the point is, if you're genetically destined to lose your hair, eventually you're going to lose your hair. Okay, that's my take on it. So For me, like, I just decided to start shaving my head. I had the same haircut in the military. It's just then it was by choice, and then now it's sort of like what is it? Turning a necessity into a virtue. Like, oh, I like it. I do it because I like it. Well, now I do it because I kind of have to. But the point is, when I saw the writing on the wall, I'm like, this is going to be kind of inevitable. So my approach was just to embrace it. I'm not saying that that's what you have to do, but I do want you to, whatever therapy you choose, whatever you choose to do about this, I want you to go into it with your eyes wide open. I want you to understand risk, benefits, alternatives, and just have a good idea of what you're getting into. Okay, guys, that's all I got for you today. If you have experiences with finasteride, or any of these other things that we mentioned in here, but specifically finasteride, I would love to hear from you, either positive effects or negative effects. Let me know what you've experienced. Okay, we'll talk to you guys next time. All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.